class, in this presentation we are going to talk about test taking strategies. Now that you have the tools to develop good study habits and good ways to take tests, we're going to go through test taking strategies, which is another way to approach taking tests and answering test questions without knowing the answer. This is just an overview, and please be aware that this takes practice and time, and I would strongly suggest that you purchase a NCLEX review book. One that I know and I've used that is really good is the Saunders NCLEX review, where it talks about test taking strategies, and then in each of their test questions it discusses the test taking strategy that is used. So that would be my suggestion. This is a introduction and a highlight. So when it comes to test taking strategies, you need to know a little bit about how a question is developed and what is all involved in that question. And we're going to look at the cognitive level of questions, the nursing process, and client needs, or basically the NCLEX blueprint, which is how all your tests will be set up even in nursing school and then when you take the NCLEX. So when it comes to the cognitive level of test questions, we use Bloom's taxonomy, and the basic or the first level of test question is known as the knowledge or remembering test questions, and these are the types of questions you would expect to see in your introductory courses into nursing. So this would be just usually based on pure memorization, and an example of that would be the level of potassium, and you would need to answer the question by knowing what the exact level is, 3.5 to 5.5, depending upon your institution and your textbook. So basically a memorization which you really need in all the test questions, because that's what you build on as you grow in your level of taking test questions. The next one is understanding what that means. Why is it important to keep potassium at a certain level, that type of thing. It moves up to applications. So now we're applying what we know about facts and rules and concepts, and that would be understanding that the effects of a low or high potassium might have an effect on your heart or the muscles in your body. So continuing on with that, and this is where you're going to find most of your test questions. It is in the analytical or analyzing and synthesizing the information. So in this case, you would be given a small scenario about a patient, and you would have to take the information that is given and apply all the facts. So you have to know the level of potassium, maybe a heart rhythm, and then the outcome the patient might have, and answer the question. Usually these two, evaluate and create, are more of a interactive type situation that you might see in a sim situation or an evaluation of your skills in a clinical setting. So that's how the questions are broken up, and this is basically an overview of the information that we just went over. The next type of question that could be used is a nursing process question, and in the nursing process we know that you have assessment, nursing diagnosis, plan, implementation, and evaluation. So when you look at a nursing process question, if the question is relating about an assessment, the answer has to be an assessment answer. If it's about an intervention or implementation, it has to be an intervention or implementation. Or if it's about a goal, the answer would have to be about a goal. And I will show you an example of that in a future slide. Then there's the NCLEX blueprint, and the NCLEX blueprint is how your tests questions are set up, and it is broken down into these four main categories: health promotion and maintenance, physiological integrity, psychosocial integrity, and safe, care, and effective environment. And this is an example from an NCLEX blueprint, and you can see where safe and effective care is then further broken down into management of care and safety. Health promotion and maintenance is by itself, psychosocial is by itself, and then the majority of the test questions are under physiological integrity, and that is because that involves basically your knowledge related to medical, surgical, fundamentals, pharmacology, and how your body adapts. So that is an example of the types of questions you would get when you're taking the NCLEX, and in your textbooks and your NCLEX review books are set up that same way. This is just a distribution of what that looks like on the test. And again, your questions in your nursing classes are usually broken up in this manner too, so that you are being prepared to take the NCLEX. So when it comes to taking a test, some basic common sense knowledge, obviously don't panic, but you won't be doing that because you now have good study skills and you've practiced some good relaxed breathing, so that's not going to happen. Make sure that you read the question thoroughly and answer what the question is being asked. Many times it is not uncommon for students to when a question is asked, start adding information that isn't there but maybe related to a past experience, and then adds to the question more with a thought process, and then it comes up with the wrong answer. So make sure that you're reading the question carefully and you're answering only what the question asks. If you have a situation where you have an instructor or an examiner, make sure you listen to what they're saying before you start the test. Have confidence in your first response, as that is usually the correct response, and it's kind of your gut response. Research has shown that your first response is usually correct because it is based on all this knowledge you have stuffed into your brain, and it just is your instinct. So you would never change an answer unless you are 100% sure, or you go back and reason it out that that was a wrong answer. In my many years of teaching, I have had many students who change their answers, and then, you know, I say, why did you do that? And it's like a bad habit sometimes. So have confidence in your first response and only change it when you feel that you're 100% correct in changing it. Avoid wild guessing, and I'm going to show you some techniques that will help you avoid wild guessing. And again, maintain that positive attitude that we talked about in the first PowerPoint. So don't panic. Keep your mind thinking throughout the test and listen to your examiner. So some test taking strategies, and these are just a few. There are more in, like I said, if you get a textbook, an NCLEX textbook, they will even give you more ideas in that. Many times the longest answer is the correct one. Don't use that and take a whole test on that, but if you would go back and look at that, you'll find that usually about 80% of the time the longest answer is the correct one. Avoid looking for a pattern code. Yes, every test could be answer A. So if you think you've answered A too many times and you don't want to go back to A, don't even think about it. The entire test could be, it shouldn't be, but it could be set so every answer turned out to be one of the numeric, like an A or a B. Look for grammatical inconsistencies, and an example of that would be if the end of the test question, or we call that the stem of the test question, ends in an A or an, then you know the answer has to, if it ends in an A, has to start with a consonant. If it ends with an, it has to start with a vowel. Look for options that are similar, because many times two correct options will be totally wrong or totally right, and you can eliminate them at that point and then go back and reread the question and see if you can come to the correct answer. Check for correct and incorrect options. Many times, and I see this frequently in NCLEX type questions, 3 of the answers are very similar in nature, and so they are wrong just based because of how they are written, and I will show you an example of that. And then you can come to the correct answer. Identify the content that is being asked, and I'll go into that in the next slides. You can learn from previous information, so you might have answered a question about COPD 2 questions ago, and sometimes that helps you build knowledge to be able to answer the next question. Be alert for details, eliminate the wrong answers. Again, read every word, read every answer before answering, and don't panic. If you start getting nervous, just take some deep breaths. So, what is the question asking? Be alert for keywords, and I will go through this with you, but keywords point out what the question is about, who is it about, to start to identifying what is important. It is as if you had a highlighter and you would highlight the keywords, and if you practice that a lot, you will get very good at that. Use your nursing knowledge, clinical experiences, and test-taking strategies. And what I just want to point out here is if you work in a hospital setting, I would suggest not using, oh, they do that at the hospital, because it needs to be based on evidence-based, and sometimes we do know bad habits can be picked up. So make sure it is from your textbook and is evidence-based. So again, I can't tell you how important it is not to read into the question, not to add information to the question, and to read everything carefully and slowly, and then through process of elimination come to the right answer. And this is always good to practice with a NCLEX review book so that it becomes habit. Keywords. Keywords help you focus your attention on what's going on in the answer or in the test question, and it helps you eliminate incorrect answers. And I will give you an example of what keywords look like. Identify who the question is about. Is it about the patient? Is it about the client? Is it about the nurse? Is it about patient teaching? Is it about assessment? Make sure you, before you even move into the test question, you make sure that it is who are you asking about, and then you can go and move on. What's the issue? And a good example of this would be a question related to medication. And if the question asks you side effects, or does the question ask you adverse effects or complications? 2 different answers, and you just have to, and it can come down to 2 words. So make sure you are identifying what the issue is that the question is answering. And that's just an example of medication, and I will give you an example of that. These keywords are usually used sometimes in true and false questions, which you will not get a lot of. You will get none on your NCLEX, but you may get in your nursing education. And what these words point out is first, initial, most important, and many times these relate to ABCs, airway, breathing, circulation. So if that is what you would answer those types of questions with that in mind first. Negative responses they are trying to take out of any nursing type test questions, so you may not see these as much as the other one, as the positive. So setting priorities, always thinking about ABCs whenever you're answering a test question, because many times that relates to the correct answer. These again are important keywords that when you see them, you know you're setting a priority, and all answers might be correct, but you are looking at what you would do first. So now that you have some very, very basic test-taking strategies, I'll give you this test, which makes absolutely no sense. So as I am talking to you about this, please read through this test question and try to determine if you can see how you can come up with a test-taking strategy that you could use to answer the question. And one of the test-taking strategies that I did not talk about, and I will elaborate a little bit after I give you the answer, is finding something in the stem of the question that is also in the answers. And so this test question would be plus and plus. In a medical or nursing example, that could be you are to answer a question related to replacing calcium in a patient. And you have 4 choices: Lasix, digoxin, aspirin, and calcitonin. And you haven't learned anything about calcium replacement yet. But you would choose calcitonin because it does relate to calcium and it has some of the same types of features as calcium. This question relates to grammatical inconsistencies, and you will most likely not see it, but occasionally you could see this happen because this test question stem ends with this. You do know that it has to start with a vowel. And these 3 you can group together. They all start with consonants, and you can eliminate those. This test example relates to absolute words, and absolute words are all or nothing words such as all, always, no, never. And if you find that there are test questions that in each answer there is an absolute word, then you can pick the question that does not have an absolute word. So in these answers here, we see that this is an absolute word. This is an absolute word. This is not an absolute word, and this is an absolute word. So even though we don't really know what this is about, we can eliminate these as not being viable choices because they contain absolute words. And just remember, test-taking strategies is just another approach to getting to a test question if you are not quite sure of the answer. You always want to know the answer, but if you don't, then how else can I find the answer? This question relates to grammar, and if you look at this, the reasons for the Tristel DOS are, we know that the answer has to have multiple or more than one answer because it says reasons. And as you go through each one of the test questions, you will see that number 1 is the only one that has 2 answers, where the other 3 do not. So I came to this conclusion because this is how that works. Finally, this is based on previous knowledge. Believe it or not, we talked about this in question 2, the Firble-Brigg and the IGNU. So now we can go back and say, well, I already know the Firble-Brigg and IGNU kind of went together, and I don't really know the answer to this question, but if I have to take an educated guess, I'm going with that. All right, let's move on to some nursing questions. This question is to demonstrate the difference between a question that is based on a physical need versus a psychological need. And if you read this test question, you will realize that this one is to meet a patient's psychological needs. And if you were going to highlight key words, you would look at the nurse, reduce, and patient's anxiety. So which one of my answers will reduce patient anxiety? We know number 1, pain medication will meet a physical need, so we can eliminate that. Number 2 will not meet any need. Number 3 would meet a patient's, would help reduce anxiety and meet a psychosocial need. And number 4 is just not correct. And if you, that would be a knowledge-based answer because you know the patient would be radioactive. So you would come to this conclusion using test-taking strategies by correlating the need to find a psychological need answer and to meet the patient, decrease patient's anxieties. This is an example of a knowledge-based question, and you just need to know that HIPAA guidelines preserve the patient's right to Number 2, maintain privacy. That's based purely on memorization and very basic, very at the bottom level of test questions. This question is talking about assessment, and this is a little bit higher level. It would be an application question, and your keywords would be the nurse is assessing, and then very important, what? Peripheral pulses. If we change that to apical pulse, it would be a different answer. And you would go through these for, I know that you would have to use palpation for peripheral, but if it was apical, you would change to auscultation. So again, understanding what it's asking and out on underlining or highlighting in your mind the keywords. This question it's important to look at the keywords before you come to the answer, and it talks about a patient who's terminally ill. So we know this patient is not going to live. It's terminally ill. And then the other keywords in this statement are, if I get over, I will travel with the church. What stage are they in? In this statement, the patient is not expressing anger. In this statement, they're not denying they have cancer. They say they have cancer. And there are no signs of depression. So your answer would relate to bargaining. If I get over. Terminally ill, if I get over, and bargaining. So this is a good example in this question of 3 nursing answers that you could group together even if you didn't know the correct answer, but they're alike. And this is talking about morphine sulfate and the nurse is monitoring for adverse or toxic effects. Again, keywords would be adverse or toxic effects. Different than side effects. We know dizziness, sedation, and nausea are side effects, so we have to eliminate all those. You may never have heard of skeletal muscle flaccidity, but if the other 3 are incorrect, you would have to answer that question with that answer. And sometimes it's very uncomfortable to answer a test question if you have never heard of it. But if the other 3 are incorrect, then you would go for that answer. So that is an example of 3 answers that are alike. This is an example of a priority type question, and in this question you're looking for early signs of hypovolemic shock. So early signs, and hypovolemic, if you don't understand a word, break it down, low volume shock. All these answers could be correct except for this one. This would be decreased. But the first thing that's going to happen when you are losing blood to your heart is your heart's going to increase its pulse rate to get more blood to the brain and to the heart. So this is the correct answer. This will also happen, but this will happen first, and the patient will become lethargic and would have decreased orientation. This is an example of ABCs and how you would pick that answer. Again, keywords that relate to setting priorities. This is another good example of many test-taking strategies in this question. Number 1, we've already talked about morphine sulfate. We looked at that other question and we knew that side effects related to dizziness, nausea, and sedation. Sedation meaning the patient may become more sleepy, and if they're more sleepy, they're maybe not getting as much oxygen to their brain. So again, what is the priority action? When we look at priority actions, we often think of ABCs. And so based on that, we would pick number 3. However, I also want to point out that number 1, 2, and 4 are all related to GI or output, or I should say fluid intake and output. So you can group those 3 together and say, well, these 3 are all alike and this one's different. This is also the longest stem. So a lot of test-taking strategies just in that question. This is an assessment question. So this is talking about assessment. This is an example of using the nursing process, and if you have a question that talks about assessment, You have to answer it with another assessment unless you have enough information to make it to decide there's an intervention. So you look at what's just happened. The patient complained of dyspnea. They're on O2 at 2 liters per minute and the respiratory rate is 22. Not too big of a concern. What should they do first? It's an assessment question. Do you have enough information in that STEM to make a judgment about changing anything or do an intervention? Or do you need more information? You need more information. You could be standing on the oxygen tube. So you would go back, check the respiratory status, and then make a decision about what to do. The other 3, 1, 2, and 4 are also interventions, so you could group them together as relating to an intervention. I'm going to skip that one. This question we're going to talk about is the same thing, but it's sort of opposite of ABCs. And this is about a patient who is going into eclampsia. When you get into your OB part of your nursing program, this will make more sense. But if a person goes from pre-eclampsia to eclampsia, there's an action you would do first. If you look at your answers below, you can group 3 of them together. And number 2, check the patient's blood pressure and fetal heart tone. Number 3, maintain an open airway. And number 4, administer oxygen. All relate to ABCs, airway, breathing, circulation. So this time, that is not what you would do first, but you would do number 1, which is prepare for the administration of MEG sulfate. Again, notice it is the longest answer, not that you would want to use it, but it is sort of interesting to see that. Here's similar options, and this test question demonstrates again how you can look at 3 options that can be grouped together. And I just want to give you a little warning or heads up. It does take practice. It's not always obvious how you group them together, but again, if you practice this, you will find that it is it's sometimes pretty obvious. So you're looking for a patient who's at risk for excess fluid volume. 3 of these answers, the patient is losing fluid. 1 is a ileostomy. You're losing fluid, taking diuretics, and you're losing fluid if you're having GI suctioning. So the correct answer is someone in renal failure. But again, if you didn't know that answer, you could look to say, who's losing fluid? How can I come to this answer without actually knowing the correct information? All right, this one looks at that absolute words we talked about, and that is if you see questions that have absolute words in their answers, then you can eliminate the correct, but you can come to the correct answer by eliminating those questions that have absolute words. And in this question, you're looking to determine that the client understands instructions. If you look at 1, 3, and 4, they all have the word must. And number 2 has the word will. Again, I don't know the answer. Can I think of a way to get to the answer without knowing it? I'm going to eliminate these questions with absolute words and choose that one. So remember, this is just a short overview to get you interested in learning test-taking strategies at a very early stage in your nursing education. You do need to put it into practice. It doesn't happen overnight, but I have seen much success with students who start using test-taking strategies early on and passing their courses. Good luck in your nursing education.